project is on integrating NTD campaign interventions into the primary healthcare system. The project team involves Dr. Teshome Gebre from International Trachoma Initiative at the Task Force for Global Health, and Mr. Fikra Saif, at the who is the National NTD Program Coordinator at the Ethiopian Ministry of Health, and Dr. Wandimagany Mbiale from Bahar Dar University, and Bahailu Markadios from Arba Minch University, and myself from Eyu-Ethiopia. Our study will be conducted in Ethiopia, and to give you a little bit of background for those of you who might be less familiar with our study context, Ethiopia is the second most populous country in Africa and is one of the countries most affected with NTDs. For instance, as most of you might know, it had the highest burden of trachoma worldwide, contributing to about 50% of the global burden. And among sub-Saharan African countries, it has also the highest burden of soil-transmitted helminthiasis and podocynosis, contributing to 34% and 25% of the sub-Saharan Africa burden, respectively. And on the other hand, the NTD intervention in Ethiopia are vertical program conducted in a periodic mass campaigns with limited integration to the general healthcare system, and are mostly dependent on external funding support. And the new WHO NTD roadmap proposed integration, as most of you might know, one for interventions of several NTDs to be conducted in an integrated manner, and two, mainstreaming NTD interventions into the national health system through changing existing operating models and culture, and also increasing country ownership. So in line with this proposed shift of approach, the Ministry of Health of Ethiopia has developed a sustainability action plan for NTD control to guide mainstreaming and integrating the control and elimination activities of NTDs within the healthcare system. However, an important question that needs answering is how we can really effectively implement this proposed shift of mainstreaming and integrating NTD interventions into the general healthcare system. And actually, there is no adequate practical evidence to guide us on how to implement integration in such complex and real-world setting. In addition, integration is also context specific, and what might have worked in one setting may not work really in another, as one setting would have different challenges and needs for support. In addition, integration of new interventions in a weak health system particularly may be counterproductive due to the additional strain it causes on already weak health care systems, such as the in endemic in NTD hyperendemic settings. Therefore, prior to integration attempt, the strategies and support needed for successful integration should be determined based on local contexts, and particularly after studying the operational capabilities, challenges, and opportunities of the healthcare system to deliver new integrated interventions. And this is exactly what we plan to do in the proposed implementation research. The purpose of our study is to investigate the operational capacity of the Ethiopian primary healthcare system and identify support needed for transition and sustainably integrate NTD interventions, and then identify acceptable and feasible strategies to partially or fully integrate NTD campaigns into the primary healthcare system. And our expected outcomes include the operational capacity of the Ethiopia primary healthcare system for NTDs. Intervention integration will be determined, and the challenges and the type and extent of support needed for integration will be also identified. And the systems and inputs of NTD interventions that can be partially or fully integrated will be identified. And also the contribution of NTD programs to the primary healthcare system itself will also be determined. And finally, we anticipate to actually develop feasible and acceptable strategies that can facilitate partial or full integration with the relevant stakeholders. Our primary research question is, what preconditions and strategies facilitate partial or full integration of NTD campaigns into the primary healthcare in the Ethiopian healthcare system context? And to answer this question, we'll conduct a two-phased multi-district mixed methods exploratory implementation research mainly using participatory action research methodology. In our study context, participatory action research is a collaborative systematic investigation and will be employed by engaging key community and health system stakeholders, ranging from primary healthcare cadres to national policymakers, to both identify the challenges and opportunities for integration, and also finally co-formulate and co-develop full range of potential NTD intervention strategies. Therefore, in phase one, for example, we'll conduct a health system readiness assessment using a health system capacity assessment framework for integration, consolidated with primary healthcare performance initiative conceptual framework, which is also called PHCPI. And in phase two, we'll first co-develop integration strategies with the stakeholders and in a consultative workshop. Then we'll use a consolidated framework for implementation research, also called SEPHIR, in an which is evaluation for a framework that will help us to clarify critical barriers and facilitators to the implementation of those particular integration strategies that are developed during the consultative workshop. Then again, based on the results from the SEPHIR assessment, we'll revise, finalize, and then propose integration strategies. These are the secondary research questions we'll be addressing, and this includes on challenges and opportunities for integration, and also system and input for partial and full integration. And also we'll be looking at NTD programs' contribution to the primary healthcare system. In terms of timeline, as you know, this funding has very tight schedule, and we plan to complete it in the coming 15 months. And we plan to get ethics approval by the end of this month, and then start research tool validation and research team training in July. Then we plan to complete phase one by the end of this year. That is the study one, which is looking at health system capacity of the primary healthcare system in Ethiopia. And by May 2022, we plan to complete the integration strategy co-development, and then final reporting and the result dissemination will happen from July 2022 onwards. Looking on challenges in the next 6 months, COVID poses really a major challenge for project implementation globally, and our project is not exception. However, we plan to continue project activities through the use and provision of personal protective equipment. And political instability currently is a major worry in Ethiopia. This project is designed to be conducted in at least 10 districts in Ethiopia, and study districts will be randomly selected from a full list of districts endemic for the 5 most common NTDs, and then those with security issues at the time of the data collection will be excluded and replaced by other districts. Seasonal rain may also pose accessibility challenges for us, particularly in some selected districts, given that the data collection for phase one will happen in the rainy season in most parts of Ethiopia. Again, in inaccessible districts will be excluded and replaced with those that are accessible during the time of data collection. Thank you.